Hi, my name is Lawrence Mack. I'm Associate Director of Clinical Integration and Partnerships. I work for the Royal Brompton and Hereford NHS Foundation Trust. I've been here at the Trust just over 7 years. And in my role, I'm responsible for working with clinical teams at the Royal Brompton and Hereford, along with teams at Guy's and St. Thomas Hospital and King's College Hospital and King's College, the university itself, to bring together our teams working in a partnership called KHP Partners to build a new cardiovascular center, which will incorporate the clinical expertise among the three main hospitals as well as the research and academic skills from the university. On a day-to-day basis, in terms of what I do at my job, I'm working principally on the first phase of this collaboration with our King's Health Partnership. I work with the clinical teams here at the Royal Brompton, so I'm working with our pediatric teams. Our pediatric teams consist of basically heart and lung specialists. So my role is to work with our team here to integrate our pediatric teams with the heart and lung teams at the Evelina Children's Hospital, which is part of Guy's and St. Thomas Foundation Trust. So there are a series of meetings. We have internal meetings talking about our services, our teams, what we do and how will that interface with what they do at the Evelina. So we meet internally, then we meet as a group with the Evelina teams and also members from King's College, University Hospital as well, to talk about patient pathways, how we deliver care currently in our existing environment. What does that mean for the future? What does that mean in terms of redesigning patient pathways and patient flows, how teams come together? So there are a lot of meetings. There are meetings every week about the clinical pathways, clinical teams, engagement. There are meetings about buildings, brick and mortar. We have to actually create new facilities. So what does that mean? So the whole team of people looking at what would this new pediatric extension look like and how will that interface with the rest of children's services at the Evelina Children's Hospital. So loads of meetings around estates, a lot of meetings around clinical pathways. Then we have this whole issue around how do we build an integrated team working on 2 sites. So that's our next phase. So we are lots of meetings about clinical practice, getting to know each other. Because we are a heart and lung specialist hospital. They provide children's services, the complete children's services. So their heart and lung are just a subset of what it is that they do at Evelina. But it's bringing the larger cardiovascular services together in those teams. And those teams include intensivists, and it includes allied health professionals, which are physios and occupational therapists, speech and language therapists, pharmacists. All of those people work together to create this new team. So that's the meetings are constant. And skills required for my role. One is experience. You have to have experience having worked in healthcare. Experience, I think what I bring uniquely to this role is I'm an American, so I've worked in 2 different healthcare systems. And how we do things in America, it's very different in many ways how the National Health Service work. So it's understanding the differences in care delivery models and making sure that you not only pull from what my experiences are, but we look around and see what's going around the world. So part of it is being able to survey the landscape in healthcare internationally to find out, because what we want to do is be able to bring in research and look at different delivery models of care. So you have to have a mind that understands healthcare delivery systems across the world and internationally. As I said earlier, communication is key, but engagement, you have to be able to engage people at every level, as I said, so those are level skills. And the other thing, you have to educate yourself. My education is very diverse. There is no straight answer to how I got here. I got here in different journeys along the way. A lot of people can figure out, I want to be a nurse, I want to be a doctor, and all of those things are fine in the straight pathway that you can get to getting there. There's some people who truly want to be administrators, like what I'm doing. But that's not my journey, and that's not how I got here. I've gotten here through trial and error. What I would tell any young person, be open, be flexible, If you know exactly what you want to do, that's great. And if you don't know, you have to try out a whole lot of things to get there, which I've done. I tried, I wanted to be a psychologist, I wanted to be a radiographer, I wanted to be a nurse, I wanted to be a doctor. I wanted to do all these various things, but the one thing I found out where my love lies was helping healthcare people to deliver care, because I just couldn't do the hands-on direct patient care. I tried it, didn't like it, wasn't me. Then I got into health education, science and biology, great. I got my certification as a science teacher, fine. I never did any teaching. I ended up working in public health, which was completely different than teaching. So you have to be flexible and go where the opportunities go where your passion is, and learn from and take in every experience that you have. My degrees are in health education, city planning, business administration, all of these things. So all not related to anything to a single chosen profession, but they've all put me on my trajectory to where I am today. In terms of academic preparation for a career in healthcare management, it is now a prescriptive way to get there. As I said earlier, I didn't get there the traditional route. I came in through trial and error, and I found my place in healthcare management. There are basically, you can go to university and get degrees in healthcare management. So if you want to get in healthcare management, you can get an undergraduate degree in business administration or healthcare management itself. You go to graduate school, you can get a master's degree in business administration with an emphasis on healthcare management or communications or marketing, whatever you decide you want to do, or finance for your MBA. You do need to understand finance. You don't have to be an accountant, but you have to be able to read financial reports. You have to understand what a financial report tells you. Because once you get into healthcare management, you're going to have a department, you're going to have a budget, you have to deal with workforce issues. So you're going to have to understand HR policies, practices, and procedures. As a part of your education, you will get that in your training and as you educate yourself in your MBA programs. You can do like I did. I have a doctorate in business administration. I didn't get a doctorate because you need a doctorate or a PhD in management to manage people. It was for my own personal goal because I was teaching at a local university. So I did it for an educational purpose, not because of practical purpose that you need as a manager. But the one thing I tell any young person, education is an investment in yourself, and that's something that no one can take away from you. So educate yourself, invest in yourself, and set your own goals about where you want to take your career. So when I did finance is very different than accounting. I think a lot of people confuse the two. When I was afraid of, my God, I don't want to be an accountant, I can't do this. But when I went through my finance class, which is a totally different way, you do understand some accounting principles, but it's not being an accountant. So don't be afraid of entering the area of finance because you're going to need that. Economics is another area. You have to understand health economics. What does all of that mean? Supply, demand, because those things are very important. The healthcare economy and the shrinkages that we're having. There's a lot more demand for healthcare services than we actually have money. So what is the future going to hold for new people coming into healthcare? It's very challenging, it's very tough, but it's very rewarding because at the end of the day, everything we do and everything we say has a focus on patients and patient outcomes. So no matter how tough it gets for you, if you want to enter this field, it's very rewarding. At the end of the day, I go home knowing that I made a difference in the lives of some sick child or some sick patient. And that makes me feel good because I, as a manager, was able to make sure that the clinical team had the resources that they needed to do their job. So your job as a manager is balancing the financial budget that you have against the needs of a clinical team so they can deliver good outcomes.